landscape of cancer through screening and education in Trinidad and Tobago. Still, she has also been making strides in taking the TTCS into new territories, pioneering an agenda for policy change in reporting the disease, and changing legislation to include vaping in the anti-tobacco bill of 2009. Dr. LeBlanc loves reading, listening to music, dancing, and being around her family and friends. And if you know her at all, she loves to love. One of her many goals is to promote healthy lifestyles and healing using Eastern and Western medicine. A warm welcome to you, Dr. LeBlanc, and we look forward to a very engaging session. So I now hand things over to you.
Good afternoon. Good afternoon. I think my phone is trying to become my camera. All right, there we go. Are you seeing me now? Let me just.
No, not as yet.
Yeah, I think one has become my camera. Hold on one second. This is what happens when I'm not techy.
Not a problem at all.
Let me see if it'll switch and then switch it back.
There we go. We're seeing something.
Oh gosh, you're seeing the back. Let me disconnect this. You can disconnect this side. Sorry about that. I really
okay. That's all right. That's
For
okay.
some reason you're not seeing me. Let me see. Oh, there we go. I'm alive. Okay, good.
There we go. We can see you now. Welcome, Dr. LeBlanc.
Sorry about that. One thing is the next. Hi, everybody. Good afternoon. So I'm Dr. LeBlanc. A pleasure to be here with you. Thank you for that lovely introduction, Kelly. So today we're going to talk, as Kelly said, about breast cancer and prostate cancer. I'm going to put up a presentation. I will go through it. The first couple parts of it, I mean, I have to bring the facts to you, and then I'll go through some nice stuff, I guess, the herbal aspect that everybody likes most times, and, you know, open to Q&As at any time. So I'm just going to share my screen now, Kelly. Screen and PowerPoint. And then we go to presentation. Can you see this? Can you see everything now?
Yeah, we're seeing everything clearly.
Perfect. Okay, great. So breast and prostate cancer. So as Kelly said, we chose these topics because, we chose these topics, the two cancers, because these are the leading cancers in women and men respectively, breast and prostate, in Trinidad and Tobago and the region and the world, basically. That's what we're seeing most times. There we go. Right. So what is cancer? You know, you ask anybody in a room and everybody knows cancer, oh my God, and they think, oh my God, cancer is going to kill you. Cancer is so bad, but what really is cancer? So cancer really is a term used for diseases in where they have abnormal cells dividing without control. What does this mean? It's that usually every cell in our body is programmed to die at a certain time. So the classic example is our red blood cell. Our red blood cells are programmed to die 120 days. Now that machinery, that mechanism is all within our DNA, words that you all have heard a lot during the pandemic, and RNA. And therefore, when that machinery doesn't work well due to some genetic mutations or something that's affecting the gene pool and the way it happens, that process, then cells grow out of control and sometimes have function and invade other tissues. And that is what cancer is. Cancer is basically bad behaved cells. There are more than 100 different types of cancer, and the cancers are generally named by the organ or tissue from which they started. So that's where we get breast cancer and prostate cancer from. Here I'm showing you, this is normal cell division. And then when we have a bad cell here, now we're supposed to have the faulty machinery can happen, but then we have cells that go around and take it out. But sometimes that doesn't happen. And so that bad behaved cell, which is the green one right here, continues to divide and divide and divide, divide and multiply. And then we get uncontrolled growth and we get a tumor. But apart from that, cancer is and has been defined as a lifestyle disease because most cancers are linked now to poor lifestyle habits. It's a non-communicable chronic disease, or NCD, all tag phrases we've heard during the pandemic. And in this case, with breast cancer, it's the most prevalent cancer in women in Trinidad and Tobago, the Caribbean, and the world. And it accounts for the greatest proportion of deaths by cancer in women in Trinidad and the world. So I always tell people that cancer in itself is a very slow pandemic. So I'm going to start with breast cancer, ladies first, and then we'll go to prostate cancer. What are the stats basically? So breast cancer, as I told you, is the most common type of cancer. But get this, every 14 seconds, a woman is diagnosed with breast cancer worldwide. I want that to just settle with you. And I want the gentlemen in the audience to understand that while women are mostly affected by breast cancer can affect men as well, because men have breasts. So we always say a lump in the breast, and that's how we diagnose breast cancer. But then would you ask yourself, are all lumps cancer? Because I'm sure there are ladies in this audience that can tell me, well, I had a lump, I went, they did an ultrasound, they said, no, it wasn't cancer, but is it really not cancer? So we have two types of lumps or tumors. We have benign and malignant. Benign are the non-cancerous tumors or lumps, and malignant are the cancerous ones. The benign tumors include the breast cysts and the fibroadenomas of the breast, and malignant tumors are what we call the adenocarcinomas or the papillary cancers, and so forth, depending on the histology and the cellular type of the breast. Benign tumors are not cancerous. Very rarely are they life-threatening, and they do not convert into cancer. They can often be removed, and in most cases, they may not return. But that being said, I want you to let this sit with you, because based on our lifestyle, our eating habits, our exercise habits, our stress coping, and many more factors, they may reoccur, especially fibrocystic breast disease or fibroadenomas, and or also our family history. But get this, the benign tumors will not spread to other parts of the body as malignant tumors will do, which is when we say metastasize or metastasis. Malignant tumors are the cancerous lesions. They may be life-threatening. And I want that also to sit with you, because cancer does not always equate to a death sentence. There is always hope. Malignant tumors can invade nearby tissues, and then they spread to the other parts of the body through the blood and the lymph after spreading nearby through local contact. And the spread of cancer from one part of the body to the other is called metastasis. So then, what are risk factors? How can we protect ourselves? What do we have to look out for? So we're going to start with factors that are lifestyle: tobacco use, smoking, vaping, excessive alcohol intake, sunlight. Because of the damage and climate change, things we hear about all the time, there's now a damage in the ozone layer. And therefore, the rays that come down can definitely affect that machinery that I told you about, and are a risk factor for all cancers, but most times skin cancer, but can also impact on breast cancer. Any ionizing radiation, so if somebody's been exposed to excessive amounts of radiation, that's a risk factor. And certain chemicals and substances such as asbestos, formaldehyde, those are other risk factors. Our diet. Oh my gosh, this is such a huge topic, because now I don't know about you, but sometimes you wonder, should you really eat? Because everything seems to be bad for you, right? So a poorly balanced diet, imbalance, and the quality of food, poor quality of food that we put into our systems, but not only that, excessive bad quality food, all of that together can be a big risk factor for cancers. Lack of physical activity, not walking, running, hiking, anything that moves and raises that heart. Being overweight is a risk factor. And again, alcohol use, as I told you, but it should be noted it's excessive alcohol intake. Then we come to family history. So if you have first-degree relatives like your mom, your auntie, your maternal grandmother, your paternal grandmother or grandfather, family history is very, very strong when it comes to breast cancer. And, you know, a lot of people will remember famous people such as Angelina Jolie, Patti LaBelle, and others who got genetic testing done, recognized they had the genes BRCA1, BRCA2, and therefore had mastectomies, cut off their breast prophylactically to prevent them from developing cancer. That's because family history and the genetics is a very strong risk factor for breast cancer. The age. So long ago, we used to say that we were seeing older women with breast cancer, but now we're seeing younger women. So this, you know, the risk factor of age, I would say it depends really on the individual and the amount of, for example, when did she have her first child? Is there a lot of hormonal exposure to that woman? A woman who's never had children, menstruation starting before the age of 12, women who go through menopause after the age of 55. So those tied in will show you a clear linkage to the excessive hormonal exposure, which is natural, but yet it's still there. And then we have tied in the use of excessive long periods of oral contraceptives or hormone replacement therapy. So those are risk factors that we can sort of modify, but some we can't. We can't modify our family history. We can't always modify when we're going to have a child. And also, I should tie in that breastfeeding or not breastfeeding is a mild but a poorly linked but a weakly linked risk factor as well. So what about men? Yes, I wanted to include this because men have breasts too. So the pecs that they move up and down, that's their breast tissue. So we definitely implore and ask men to pay attention and have their self-breast examination done and have any lump checked. And men's risk factors are just what I said there. So what do we do as women and what do we have to look for? So it's important to understand with breast cancer, and October is Breast Cancer Awareness Month, so everybody wears a pink ribbon and everybody says, oh, I have to get my mammogram done, my ultrasound, oh, I can check my breast and all of that. But what are you really looking for? So the thing to look for is, for example, drastic change in size in one breast or the other, a lump in the breast that you didn't feel before, and I'll get to that, unusual bloody or nipple discharge, especially from one breast, irritation or dimpling of the skin, breast or nipple pain you can't explain, it's not coming cyclically, it's not tied in with your menstruation. All of a sudden your nipple that was pointing out is now pointing in, it's flattened. You see redness and a flaky skin around the nipple, and it's usually on one breast or on the breast itself, a rash around the nipple. But I told you about the change in size, and then most importantly, a change in the texture of skin where it looks like an orange almost. Those are important things to note as a woman, and even dare I say a man, in terms of thinking of breast cancer, right? So when I say note it, what does this mean? It means screening. What is screening? Screening is where we are looking for a disease in a so-called normal population. So breast cancer has, and I like this about breast cancer, that it has many screening tests, so to speak, that together give you a more definitive answer. The gold standard screening test for breast cancer is the mammogram. However, women can and should at home learn to do their monthly self-breast exam. Now, we implore and love to encourage that young girls are taught from a very early age, from the minute they hit puberty and start to have breast tissue, how to examine their breasts. Once you have your period, about 5 days after your period, you should perform your monthly self-breast exam. If you're no longer having your period, we advise to choose the same day every month to do your breast exam, and that's monthly. Then you have your clinical breast exam, and that's done annually with your physician or your nurse practitioner or your RN. And then the mammogram, which is done every year, and it starts usually between the ages of 35 to 40, again, depending on family history. And I want you to understand that that is screening, and that doesn't mean that a younger woman who has an issue cannot have a mammogram, but an issue has to lead to that workup. And then it may no longer be called screening because we're actually seeing an abnormality and going to it. So that is where we're looking for a diagnostic workup. A mammogram. A mammogram is a very simple X-ray picture of the tissues inside the breast. So as you know, it's two metal plates that come down on your breast. Oh, don't worry about it. It's uncomfortable and generally not very painful. That's why we wait until after your period, because less hormonal sensitivity, and it's not in ovulation. So you girls out there, you ladies out there, understand what I'm talking about. Apart from that, with the mammogram, we can then add in the ultrasound and sometimes the MRI of the breast. But it should be noted that the ultrasound and MRI are not the gold standard screening test, and the mammogram is. So then how do we diagnose breast cancer? So let's say you've done your screening, you've gone to your GP, everything has been looked at, they've decided we need to work up, there is a lump, there is something there, we have to work it up. Then what happens is that we now go into a diagnostic phase. So it's no longer screening. And this is where we do what we call biopsies. The biopsies are taking samples of the abnormal tissue and sending it off to pathology to be tested. So we see the histology or the cellular type. So this can either be done with an ultrasound guided fine needle aspiration, or sometimes we have to go into theater and cut out a piece, depending again on the patient, the size of the lump, and the circumstance at that time. And then we send that sample off to pathology, and then they do their staining, their processing, and then they come back and give us the answer. Is it cancer? Is it not cancer? Is it hormone receptive, positive or negative? So all these words come out. And then once we have that diagnosis, then another holistic team is what will guide you through that process of dealing with that diagnosis. So what is the treatment for breast cancer? I know a lot of people are very scared when they hear treatment for breast cancer. Is it, I'm going to lose my hair, I'm going to vomit every day, I'm going to lose weight because of chemo. But, a lot of things have changed. We've had a lot of, dare I say, advances in the treatment of breast cancer and all cancers, to be very honest. And therefore, treatment for breast cancer depends on various factors. It depends on the stage of the cancer. It depends on the type of cancer. It depends on the patient themselves. They have an input on what they're willing to do and not do. But generally, treatment can consist of these factors, but it doesn't have to be all. It can be either or, depending on the factors I just told you. And the treatment can include surgery, and that could be taking out just the lump. It can be a mastectomy of one side, so a unilateral mastectomy, cutting off the breast on one side with taking out lymph nodes under the armpit, which is called an lymphodectomy. You can have a double mastectomy, which is cutting both breasts off with lymphatic clearing. And that again depends on staging. It helps us to stage as well. What does that mean? When we diagnose breast cancer, we have to determine the stage at which it's at. And to do that, we have to know, did it spread? Because remember, I told you the word metastasis, because that determines your treatment possibilities. So what will happen is, if the surgeon takes out a lump and it's diagnosed as cancer, and the surgeon says, okay, let's do a lumpectomy, they still have to go clear the borders and take lymph nodes, because the lymph nodes are what drain our lymphatics from the breast into the axilla or the armpit. And therefore, they have to take out lymph nodes so that they can then see if any of those lymph nodes are affected by the cancer. And that allows us to help with the staging, along with doing a CT scan to see if there's spread anywhere, and that comes together to give the full picture. Apart from surgery, we have chemotherapy, which we can have different types of chemo. There are different drugs that we use in chemo. Hormonal therapy, which is actually a type of chemotherapy, but it's hormones, because based on the receptors of the tumor, we may give hormone blockers because hormones may be stimulating the growth of the tumor, and then radiation. So those are the options when it comes to treatment of breast cancer. I like to add myths because there's so many myths out there, and so everybody is a Google doctor. Everybody has their own opinion. TikTok is now the latest doctor as well, and I appreciate the information being put out there, but that allows us as physicians to come and clarify as well. And I am, if anybody knows me, I will never lie to you, yeah, most times. So myths. Mammograms do not cause cancer. The myth is that they do. They do not cause cancer. They will not crush the tumor and spread it. Mammograms will not cause cancer. Red meat does not cause cancer. If you have excessive red meat intake, we do note that depending on the quality of red meat, that it is a risk factor because of the hormones and the pesticides and the types of elements that they've given the animals to eat. So that is a possibility, but it's not that the red meat directly correlates to causing cancer and that sugar feeds cancer. So people think they can't eat meat, they can't eat sugar, they can't do nothing once they're diagnosed with cancer. And then they have a life where they're like starving themselves, not happy, and then facing chemo, body not nourished, and then they're just going downhill. And that is what we want to avoid. We want you to understand that being diagnosed with cancer, yes, there's different things we clean up with your diet, but it's not totalitarian. It's not you can't. And we have to take this in moderation and understand it. Use much less or no processed foods, you know? Sorry. And understand the type of sugars you're using. Do you really need excess sugars? Do you need, and not using white sugars, using honey, using brown sugar, using cinnamon? There are different things that we can do, but these are myths that I would definitely like to dispel. So then we come to prostate cancer. Prostate cancer, risk factors. So first of all, I should tell you where the prostate is. The prostate is an organ only found in men, and the prostate is what produces the ejaculate, which is what the sperm swim in, and it's located in the pelvis of the men underneath their bladder. So risk factors for prostate cancer: family history of prostate cancer, a poor and imbalanced diet, lack of physical, again, this is ringing the same risk factors for most of the cancers, because remember I said cancers are lifestyle diseases. Contact with carcinogens, again, those chemicals, and again, you see smoking and or vaping or tobacco use. So I want that to sit with everyone in the audience, because I want you to understand that yes, every cancer may have one more risk factor that may be specific to it, but on the whole, cancers have a general group of risk factors, and this is where we need to educate ourselves, empower ourselves through education, and get screened, because we have to understand what we as individuals are at risk for and how we can make those changes and modify them. So there you go. The prostate gland is right here, as you can see on the arrow. It's a walnut-sized gland, and you see it right there under the bladder, and it produces the ejaculate, which will then go through. The urethra passes through it. So this here is the bladder, and the urethra is the tube that takes urine from the bladder through and out to the toilet, dare I say. So if this gland grows and is affected, we can see where you can't urinate, because it's going to squash and squeeze this urethra here, this tube right here, and it's going to push on your bladder. So then you can't hold in your urine, right? So that is what the prostate is about. And it starts to develop just before birth and continues to develop into adulthood. It should be noted that as men get older, the prostate can get bigger, but it doesn't mean they have prostate cancer. And that's where what we call benign prostatic hyperplasia, right? The growth of the prostate is fueled by our male hormones, which is androgens, or mostly people know it as testosterone. Before we go to, well, let me do with screening, and then I'll tell you the signs and symptoms. The screening for prostate cancer includes the PSA, or the blood test, and we usually look for readings under 4 nanograms per millimeter in the blood of men. And then we tie that in with the digital rectal exam, which is the exam that most men in the Caribbean used to fear, but we are truthfully seeing a change in that paradigm and a change in this culture, but we have to do more work to reassure men on the importance of the digital rectal exam at this time, tied in with the PSA. So what are symptoms of changes in the prostate? As I told you, a man's prostate can grow and it doesn't have to be cancer, right? And a man may have prostate cancer, and I've seen this personally, and not have any symptoms. But what are symptoms that should alert you and make you go to the doctor? And apart from having your regular screening, if you have these symptoms, go to the doctor to get checked out. Urinary problems. So that's where you have an urgency all of a sudden. You can't stop holding your pee, or you're going to urinate and you're urinating very small amounts, and you find that you're no longer peeing into the bowl, but it's going on your toes, or you might be dribbling, or you might see blood in the urine, or you might see that you're having a difficulty to start that urine stream, or you can't stop it as you used to. And those are all different times. And then let's not forget getting up forever in the night. So 3-4 times in the night, you need to urinate and you can't sleep properly. And then the flow is no longer as it used to be in terms of the stream being strong. It's a little weaker, so to speak. Now, it's important to note that that is a normal thing as well with age. So it's important to note those symptoms, because then you can get worked up, have your screening, etc. Pain or burning in urination. Again, the urine flow that starts and stops. So you're urinating, it goes boop, 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 stopping. Difficulty having erection, so erectile dysfunction, where you're not getting your erection as you used to, and it's not just age. Frequent pain in the lower back, the hips, the upper thighs, and not all these signs and symptoms mean cancer. It could be an infection or something else, but it's important to note these symptoms, because then you can get worked up by your physician. But it's also important to screen, because again, we're looking for disease in a so-called normal population. So I put this slide in because a lot of people are afraid of the digital rectal exam. It's actually more time to prepare a patient for the DRE than to actually do the DRE. And this is where we, the doctors, will use a gloved finger, lubricate it, and we insert it slowly into the rectum to feel the back of the prostate. Because when we feel the back, we're feeling the size, we're feeling the texture, we're feeling if there are any lumps, we're feeling if it's hard, and we're also looking to see if the patient has any pain when we examine. I can't impress upon you enough the importance of screening. Screening, again, is where we're looking for a cancer before the person has any symptoms. We are looking for abnormality before it gives you bad symptoms. So when we find it earlier, not only is it an earlier stage, it's easier to treat or even cure. And it's much less traumatic, dare I say, on the patient themselves. When we wait too long, then it spreads to more parts of the body, and it makes it sometimes very harder to treat or cure. But note I say harder and not impossible. It's important to remember that when your doctor recommends these screening tests, it doesn't mean we think you have cancer. It means this is the age at which we note that we are seeing cancers, and this is when we start screening. So it's very, very important for you to do your screening. For prostate cancer, who should get screened? Men from the age of 40 years old. Sometimes it might be less, depending on the family history. Men with a strong family history of prostate cancer. Annual screening, don't miss the years. Annual screening is important because we can see the difference over the years. So sometimes we see that PSA rising slowly and we say, well, why is that rising? And we can make sure we do further workup to see what's going on. And also we can see if your symptoms change, if anything changed over the year, right? At this time in Trinidad and Tobago and the Caribbean, the best screening test is the PSA with the DRE. At this time, right? That's what the evidence is showing us. Again, so we've done our screening. What happens if we're suspicious? Let's say the PSA is elevated. Let's say the DRE or the rectal exam was abnormal or suspicious, or both tied in were suspicious. Then we recommend a transrectal prostate ultrasound. And that is where we look at the gland in its entirety via ultrasound. And if we see suspicious lesions in the gland at that time, then at that time, the radiologist will take samples of the lesions and therefore do their testing to see what is abnormal. The next few slides are going to be pie charts. I am putting these pie charts because I think it's important for us to understand where we are when we speak about cancer in society and why we need to continue screening, but not only that, why we need to improve our lifestyle choices and make those small yet impactful changes. If we look at Trinidad and Tobago, and these are the latest statistics, we look at the mortality or the death profile by cancer in Trinidad, prostate is in the blue and it covers the greatest proportion, right? And then we go, so this is in men. So prostate is 34.8%. And it's important to understand that. It's the most frequent cause of death by cancer in men in Trinidad and Tobago, right? And that is the importance of us checking. I went on GlobalCan 2020 because we wanted to see the number of new cases in 2020. So statistics are always going to be a few years behind because it takes time to report and to collate and to do the analysis. What are we seeing here? In all ages, for both sexes, we're seeing the two most prevalent cancers. So I didn't lie to you, prostate and breast. These are the number of new cases. If we keep going how we're going, that is what GlobalCan is saying. And that's the Global Cancer Registry is what we're going to expect. Females, so breast cancer, look at that. Of all the cancers, breast. So we're not seeing a prediction of cancers going down. So then I said, well, let me look at new cases of breast cancer in the region. And if you look at that, that in itself is impactful. Because look, we are considered the Americas and we are not far behind the other two major continents and regions. And this needs to sit with us because we have to make the change because we also have another thing against us, and that is our socioeconomic status, meaning the cost of treating a cancer patient. And that's a heavy, heavy burden on our economies. And therefore, we have to do better and make better lifestyle choices. Again, this is the Caribbean. Again, I am just doing these pictures so we can let it sit on the cancers. And if you look, behind here is the colorectal cancer, which which I know we'll probably speak about later on. But prostate and breast again. So those are leading. So does this mean that all hope is gone, that is doom and gloom, or can we really do anything? And we can. We have prevention. We don't have to panic. We don't have to be fearful. And then, of course, you have herbs and other complementary practices, which people speak a lot about, especially now. And I am here to tell you, to answer if they really make sense and when do they make sense. So I said don't panic and don't be fearful because, as I told you, the diagnosis of cancer, breast, prostate, any cancer, does not have to equate death. But we have to be proactive. We have to do our part in preventing or diagnosing it early. And this means lifestyle changes, screening. Screening. The cancers we can screen for, we have to screen. Listen to your body. Do your annual checkups because those are the checkups, that show the changes in the body every year. And you have that rapport with your physician and you say, you know, this is changing, that is changing, what is really going on? But that is what we need because, again, that in itself is a type of screening. When I say lifestyle, everybody's going to throw up their hand because budget came out, I can't afford nothing, what are we going to do? But it doesn't always mean expensive. We have to look at what we eat. We have to look at how we move and how we sleep. You know, we know not to smoke and not to vape. We know not to do these things. We know not to have excessive alcohol intake. What do we eat? We need to eat as natural as possible. You need to eat what belongs to us, what's from our region. It is recommended that we eat what we grew up on. You know, and it's about the quality of food that we grew up on as well. So we have to talk to our farmers, our grocers, our our greengrocers. How do you grow it? How is it? We have to look at if they're using excessive pesticides. We have to be, as the consumers, we have to dictate what is brought to us to the table. And it's very important. Apart from that, when we talk about herbs and other practices, a lot of people say, well, I don't have to do chemo. I could eat soursop and I'll be cured. I could drink this and I'll be cured. Noni, moringa, acai berry, apple cider vinegar, and the list goes on. So I do herbs and acupuncture, and I can tell you that it doesn't have to be either or. It should be complementary. It's where we use both herbs, acupuncture, moxibustion, all those complementary practices to complement the treatment regime that's happening to help with the side effects, to help boost the body, and yes, to help the medication work better. It's so important not to do either or. It's important to listen to your physicians to make sure you have a very holistic treatment regime. But let's not say you're diagnosed by cancer. Should I be drinking ginger and turmeric every day of my life? Should I be eating noni leaves or moringa leaves every day of my life? Should I have a noni fruit every day, drink aloes, and the list goes on. Black seed oil, olive oil, and it goes on and on and on. Lemon water and so forth. Everything in moderation. I do everything in moderation. I recommend that you certain things you do for 6 weeks, you take a break, because these things are supposed to change your body chemistry and make you healthier, supposedly. But you also have to think about what is practical and don't overdo the do. You understand? Because if you know the quality of food you're eating and you're really eating good quality food, then really and truly, there should not be that much body. So it's about tying it all together. How I sleep, how I stress cope, how I exercise, what herbs do I want now? What kind of food am I eating? And all of that has to be tied together with screening, with going for your annual checkups, understanding that, looking at our selective plumpness, understanding that. And that is how we as patients and individuals in society can make a difference when it comes to cancer. So, I want you to think about that. I don't want it to seem insurmountable. I really want you to understand that we don't have to take cancer as something that will scare you to the bone and you're fearful and you don't know what to do. And, it's important to understand where you as individuals have the power, where you have the tools to be empowered and to be proactive when it comes to your health and your healing. Yeah. I thank you so much. I want you to remember that early detection is what saves lives, and this is what we need to do. Please get screened today, and I'm definitely open for any questions now.
Thank you so much, Dr. LeBlanc, for your presentation. I think it was very engaging and very, very informative, guiding us. And you're not, waiting for something to happen, and the doctor said this is what it is, but kind of taking preventative measures, adjusting the diet, adjusting, your lifestyle, exercising one, most importantly, doing the screening. So again, not waiting till we find a lump or something is wrong, but actually yearly, doing it, because those things do help, So we are now we've opened up our questions and answer segment. And if you have questions for Dr. LeBlanc, if you want to ask a question, just raise your hand, we'll put on your microphone, or you can put your questions in the chat box. I am seeing a question here. Is it also a myth that airport scanners cause or contribute to cancer?
I know. Oh my God. Y'all won't get me in trouble with customs and immigration. So it is a myth because it's very low dose. I don't even think they're X-rays, but it's very low dose, and it is proven that it has consumer safety. So they will not cause cancer. Yes.
Okay, so that don't tell customs you're not passing through their scanners,
Dr.
please.
LeBlanc says it'll cause cancer. Oh
Yeah, that might lead to some trouble. Do we have any other questions? Any questions coming forward that you may want to ask Dr. LeBlanc? Take the opportunity to ask.
pick my brain.
Yes.
I mean,
Dr.
while
LeBlanc,
you, yeah, go ahead,
you
go
go,
ahead.
you go ahead. What I was gonna say is I know that you combine both Eastern and Western medicine, and you were saying that not every herbal medication, not every bush that is outside, you go pick and boil and drink.
You know,
Is
it's
it?
funny. It's it's so funny because we can't deny our herbal traditions, what Tanti taught us and Granny. And I love to hear those stories from our elders of all our cultures and our countries. But we have to understand as well that herbs are very potent and medicines
Yes.
came from herbs. So it's not from, it's real stuff and it's real medicine. So that is why, for example, excessive, because sometimes we see, for example, I could name some plants, St. John's wort. If you're on antidepressants, that could cause problems. It can affect with contraceptives as well.
Right.
Belladonna, that can send your heart out to whack. You understand? Too much turmeric plus warfarin, well, you're gonna bleed out your guts. You never know. You understand? So I mean, moringa or saijan, I mean, sometimes that could cause your liver to go crazy. So this is where we say it is important that you meet with a certified herbalist and you understand. But not only that, know that one herb might work in you and it
But
mightn't
may
work
not.
in me. It might send
Yeah.
me crazy. So we have, because it's a balancing act. It definitely is a balancing act. But I love my herbs, eh? I love my I'm a herb girl.
I see Camille is raising her hand. She wants to ask a question. Camille, would you like to unmute your microphone? Can you unmute your microphone to ask your question? Yeah, Camille, are you able to unmute your microphone? Let us know. Okay, so while we're waiting for Camille I don't know if it was an error or she did actually want to ask a question, but we'll continue ahead.
Yeah.
But yes, and it is quite true what you're saying that a lot of people now, instead of going to the certified doctors, it is Google and TikTok and I'm guilty of it too, Dr. LeBlanc. I have
But
also,
you're
but
not.
I also know at the point when I need to go to a doctor.
No, and I appreciate, and even let's not get it wrong. Like I'm on Instagram, I'm supposed to go on TikTok, because we as doctors try to help debunk the myths as well. But
Yes.
sometimes, man, some information out there is so convincing. So I think
Yeah.
it's important to take it with a pang of salt. And I tell my patients, bring the information to me. Let me help you. Let me tell you, because there's a reason we study. Now, that being said, I would like it to be noted that you could have bad doctors. It's just like you could have bad accountants and bad lawyers. It's bad everything, right? They're human beings. So it's important to understand that if you don't feel comfortable and you listen to your body, especially women, we have that, and men as well, listen to your body and don't be afraid to get a second opinion or even a third opinion. Listen to your body, ask the question, knock on the door, and get those answers. Very,
Yeah.
very important.
What advice do you have for women? So I've heard many women say this, that they have what they call lumpy breasts.
Yes.
So
I
that there's
am.
no there's no distinguishing between what's an actual lump and what might just be tissue.
Right.
Um, do you have
So
any advice for, I mean, it can't be running my doctor and doing a mammogram all the time.
So, but you see, this is where you learn your breast and
Right.
understand your breast, right? So this is where I tell women feel their breasts during their period, after their period, and during ovulation. So you could feel the difference in your breasts. And so, like, I mean, you must know when a lump change, right? Especially lumpy breast women. We know when a different lump show up. You understand? So you have to know your body and understand it. And if you feel it different, I mean, they won't send you for a mammogram straight away, but there's a certain feel that that a lump might have. But not only that, you need to get this information to the doctor when you go. I felt a different lump. It's not going and coming. It's not disappearing
Right.
my cycle. It's increasing in size very rapidly. You know, I'm just not feeling right. Those are important things to tell the doctor. So you're not wasting time. You're going with that information for them to then do the workup. You understand? So that is very important to know your body as well.
Izzy Camille has put her question here. So is an increase in inflammation in your body a risk factor for cancer?
Yeah, Camille went for the jugular. So inflammation, I think it's about that. Inflammation is a very natural response of our body to anything that is causing danger, right? But sometimes our body can overreact and give excess inflammatory responses. So inflammation is anything that includes fever, swelling, and increased mediators, so to speak, or the white blood cells we've all heard during COVID, all those inflammatory markers come to help you, right? But sometimes there's too much. It has not been proven that inflammation, excessive inflammation, is a risk factor for cancer. Yeah? So diseases that have excess inflammation in the body include autoimmune diseases, arthritis, for example, osteoarthritis, rheumatoid arthritis. There's certain autoimmune diseases of different organs and just generalized autoimmune diseases. And that is what it, but so I wanted to be honest that not all inflammation is bad inflammation. Sometimes we need inflammation because inflammation is actually helping us. So it's actually coming to heal, but it's when it's overdone is the problem. So this is about, you see the moderation team coming in again, but it's not a known risk factor for cancer.
In some instances, women do they do the mammogram. Now you said that is like the primary test that could tell if anything's wrong. But sometimes when women do mammograms, they're then referred to do an ultrasound. Why would those kind of circumstances
I love that question.
happen?
What happens is the lumpy breast women and then the women who are younger than they appear, and also us women with ethnicities. So African descent and also Asian descent. We tend to, for some reason, have dense breast tissue. So when we do the mammogram is squishing your breast to see all the tissue. But if it's very dense, and I don't mean to make it sound like a pancake, but if it's very dense, then you mightn't see the lump or you might be confused. So what you do is you tie in the ultrasound with the clinical breast examination to then be more thorough. So the ultrasound will then say, okay, I'm not seeing anything or I'm seeing something. And sometimes, Kellyanne, what they do is if they see a lump with the mammogram and there's something with the ultrasound, they might say, let's do what we call a spot compression.
Right.
So that is, they go into the spots that they're thinking, and I hate to say this, but they have to press harder because they have to make it flatter to see what they see it, right? But it ain't gonna last long and it ain't gonna kill you.
So if the ladies don't get too concerned about their, the flatness that the machine will flatten your breast.
And let me tell you, the Cancer Society has the latest technology, and it's the machine that is the least compression pain machine. So that means we're not that. Although my hand is going like this, it's not going to be like that. It goes down just to let you see the breast tissue.
And that is correct. I could vouch for that it is not painful. The machine, it's
I'll send
sometimes
money
it's
to you
probably
later,
painful.
Kellyanne,
Now
for that.
it's bearable. It's comfortable enough,
Yes, it is. It is.
right? Do we?
I saw another
Oh,
question.
there's another question here. Yes. Are there risk factors associated with cosmetic breast alterations and the popular other body part adjustments?
Lord, you're all going for the jugular tonight, boy. Um, so breast enlargement, enhancements, implants are generally not risk factors, but women still have to do their screening with those enhancements. So they're not noted risk factors, and it's important to understand that. But you do have to speak to your plastic surgeons when you're doing those enhancements.
Okay. I know you said so
some people do they cut off the breast prophylactically. They do their mastectomy and they put on 2 perky ones. They don't need bras anymore. It's important to understand that you have to make sure, because sometimes you could have breast tissue under your armpit. So sometimes they do a mastectomy to get these perky breasts, but they didn't realize they had breast tissue here, and that is where the cancer comes up. So that's why doing your self breast exam, I want you to make sure that you examine the breast, but you also go under the armpit to feel, because you have to note that sometimes you have breast tissue under there.
So in instances where a person would have been diagnosed with breast cancer or any form of cancer really, and they've undergone all the treatment, the radiation, the chemotherapy, all of that, and then eventually the test showed that there are no more cancer cells. Sometimes people say, well, I'm cured of cancer.
Yeah.
I talk a little bit about, and then some years later, exactly, there isn't actually a cure for cancer, is it? You're more living with.
You're cancer free. You're in remission. And you could think of it as a cure, but you have to be constantly on the lookout. You have to do your screening still. You have to do your follow-ups. Don't fall off the map, because unfortunately, especially where breast cancer is concerned, if you didn't have, let's say, a full double mastectomy, sometimes cancer can reappear. So it's important. And, more and more we're speaking about genetic testing. And that is because sometimes, depending on the type of cancer that you're diagnosed with at the time, that may lead to more risks of other cancers, gynecological cancers, which in women especially, which includes our ovaries, our uterus, and our cervix, which is part of our uterus. So this is where the conversation comes in. And unfortunately, it's male doctors that like to say, well, we just clean you out completely, And they're like, well, am I still a woman? If you cut off my breast, you take out my uterus, you take out my ovaries, what am I? So it's a conversation that has to be very delicately had, but it has to be had, because we have to understand your risk factors, especially with the genetics.
Can you maybe talk a little bit about, again, the treatments? A lot of the time it's chemotherapy and radiation, or either or sometimes together.
Yeah.
Can you talk about the distinction between the two, and why sometimes it would be the two sets actually together?
So sometimes, radiation especially is used to shrink tumors. Right? So they go in with rays and they go target it and they bring it down. Chemotherapy is used to mop up the cancer. So it goes in the vein most times, or you do tablets. And what happens is that chemotherapy will never distinguish between normal and abnormal cells. And that is the kicker. That is the kicker, because they're trying to slowly do better, and they're getting better at it. But remember, these cancer cells are really normal cells that behave bad. Remember I told you that? So the drug seeing all them cells equal, right? Because it's the same architecture, it just decided to grow out of whack. So while it's killing the cancer cells, it may affect normal cells. And that is why we say, nourish the body, be prepared. You understand? But chemotherapy is what it says. It's drugs, and they usually do like 1 or 3, a combination of 2 or 3 sometimes, in the vein. And you get chemotherapy. Again, the oncology team will determine how many sessions, how often, and you do blood tests during that whole process to make sure your body can handle it, your platelets, your white blood cell count, your blood count itself, or your hemoglobin levels, to determine if you can stand that chemo. Radiation, so again, depending on the type of cancer, Kellyanne, then they may decide you should do some radiation. Because sometimes when we cut out the tumor, we do the mastectomy, we cut out the prostate, we do whatever, you never know if that tumor seeded. And if it's seeded to nearby tissues and you missed it, this is where radiation may be needed as well. And in prostate cancer, for example, we do a lot of radiation, targeted radiation to the prostate, and as well pelvic radiation, and then they have gold nuggets that they put in around the prostate.
Wow.
I must say, prostate cancer is really one of the cancers that they've done great strides in, and that is where the earlier you detect it, the better your chances of survival and living to tell the tale and living a normal life. But it's really dependent on the type of cell, because our breasts have different types of cells and our prostates have different types of cells, how much it's spread, how the patient is feeling, how the patient reacts to them for them to determine what is needed or what's recommended, I should say.
Right. Camille has another question here. She's asking, how likely is a stage 1 breast cancer diagnosis to become a higher stage even after chemo and radiation?
Right, so not very likely because
Right.
it's local. So once you get a stage 1 and it's cut out and everything, they may offer chemo as just a prophylactic, just like a 1 session to mop it up, depending on the cellular type. But it's least likely for stage 1 to progress on to reoccur. But that being said, I have seen it happen sometimes, and that is tied into the genetics, your family history. Yeah.
Can you tell us a little bit, they have those different stages, and you've been talking about a stage 1, stage 2, stage 3, and then you hear about when you reach stage 3 and 4, that's it, there's nothing more that can be done. What's the, how should I put it, the progression of those stages? You understand what I'm asking?
So every cancer, this is going to be more confusing because every cancer has a staging system, right?
Right.
So we look at, there's called a TNM classification, and that is tumor, nodes, metastasis. So that means how big is the tumor, how many nodes are affected with the cancer, and M for metastasis, has it spread, and where has it spread. So based on that is how they get stage 1, 2, 3, and 4. Stage 1 is generally a local. So and stage 1 then has 1A, 1B before it gets, so you have in situ, stage 1A, 1B, and so forth, right? And so it's all based on a classification, but stage 1 is generally local and with no local spread. So it's one solitary tumor, no local spread, may have no nodes or no metastasis, right? So it might be a T, depending on the size of the lump, it's then the T, and then you get NM, and it might be 0, 0, right? Then you get stage 2. Stage 2 is that it has now started to go into the local tissues and maybe in nodes, right? So it hasn't metastasized totally to distant parts. So it's just going locally. And then stage 3 is, okay, it's going locally. It's now gone into much more nodes because it's also the number of nodes, which nodes, and then it may be going not only neighboring organs, but you're seeing it more in the vascular system, right? And then stage 4 now is when there's the tumor, everything there, but distant spread. So your breast went to your brain or your lung or your bone, sorry. Oh, sorry, my daughter is in the kitchen. Sorry about that. So sorry about that. So, or to your liver, right? So different. So that's when there's distant spread. So the organs aren't necessarily related, but because it's hit the vascular system and the lymphatic system, it's which is what takes our blood, our lymph, all the word circulation, the key word of circulation. It takes it through to the organs.
Which explaining all that, really drives home the point of that early screening and checking and doing your test regularly. And, if something is wrong, going and checking it, because I've heard and I know people who it's already past stage 2 and they wouldn't have checked anything before. So when they finally, when they finally recognize something and they've gone to check it, it's already, past that very, very early detection stage.
And then, like I have patients who have stage 4 breast cancer. So stage 4 breast cancer is called what we call metastatic breast cancer. And metastatic breast cancer is complicated. It is sometimes where the word palliative care will come in. And it's important to understand there are two types of palliative care. Palliative care can be stable disease and you're on constant treatment to keep that disease stable and at bay, but the disease is there. It's in all your body. Yeah. And then there's palliative care, which is end of life care. Yeah.
Yes.
But I want people to understand that because metastatic breast disease, and I know anybody who has TV, who has cable, internet, anything, you will see more and more that they're bringing out drugs for metastatic breast cancer because there is still hope. So that's important.
Yeah.
It's important to understand that, yes, you have spread, you have distant spread, but there is hope. And, you know, my grandmother, before she died, you know, I never forget, she always said, pain is inevitable, suffering is not. You know, I'm not suffering. And it's about death with dignity. So this is where she chose hospice care and palliative end of life care, which coincidentally, Cancer Society does offer through Vitas House Hospice in St. James. But it's important to bring it home that, and she always said that it's about quality of life and death with dignity. And so metastatic breast cancer is real, but it's not that you're going to die right now, but it's that
it's not death sentence.
It's spread and they can't do anything because they try to go and clean up, it's still gone, it's spread. So now it's about containing it and keeping it stable.
Right.
Yeah.
We have a question here. Can you explain what is meant when people recommend a low inflammatory diet?
Oh God, yes, I know. Drink water. So this is where the preserved foods, heavily preserved foods, endless white flours, white sugars, high fructose corn syrup, the 3-letter fried chicken thing, you know, and the 2-letter one that is home, you know, those things, when you have too much of that with those oils, those saturated fats and, you know, those things in excess. So that causes, what happens is, it's in our blood, it's in our system. And sometimes, again, our body recognizes that there's a problem, right? So it comes to try and save it, but in trying to save you, it's causing an inflammatory response. So the diet is what caused the body to then say, I need to clean it up. And by cleaning it up, it's inflammation. So a classic example of that is your heart. If you eating bad all the time and you getting high cholesterol, but you saying, well, I have to die of something, plus you're smoking, plus you're doing other things, those arteries start to get filled or blocked with cholesterol, plaques. So the plaque is there. So guess what? As your blood passing through, your blood has the white blood cell, the red blood cell, and the platelets. So guess what happens? The platelets stick on that plaque. So when the platelets stick now, your white blood cells say, but it look like you have a problem. Let's help you. So it comes and it starts to try and clear it. But trying to clear it, what does it cause? Inflammation. So you then have an inflammatory situation. So this is where foods can cause inflammation in that roundabout way. Yeah. I tell people, you know, nothing in excess. Look at the quality of your food, and that is how I approach the so-called inflammatory diet.
Yeah, all things in moderation.
Yes.
So we have a few questions coming in, which is great. Can high stress levels cause cancer?
That's why I laugh. I want to be careful how I answer this. If you are highly stressed and you are not coping with your stress, and so you just going, and like you like a pressure cooker. If Kelly call you, go, and you're just like going crazy. I mean, that is an inflammatory pressure cooker. Yeah. And what did we just say? Because here what happens? Your body's in this fight or flight, right? It ain't getting to rejuvenate. It ain't restoring. Nothing happening. You ain't exercising. So guess what? Nothing can clear those inflammatory markers because of stress. Because stress means everything need to save you now, but it's constant fight or flight. So then we come into these things. You must have heard them superoxides. So this is what superoxides are really in our body, and they come and they clear out the excess inflammation. But if we're in constant fight or flight and we're not rejuvenating, we ain't breathing, there's no 5 minutes zen is, it's like, oh God, did I have traffic, oh God, and it's going on and on and on and on. Then this is where that can then affect the machinery. And if it affects the machinery, affects the way your cells are dividing and the way your cells are supposed to die, or apoptosis and all I told you about, then theoretically, and we know, it can be a risk factor for cancers.
Right.
You like that?
Yeah. 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 I mean, stress, not just cancer, stress leads to all sorts of different things. And that's where the exercise comes in, even simple, just walking, or even 15 minutes doing some yoga, not the bendy ones, but just the breathing yoga. All those things help to decrease the stress levels.
Very, very important. I can't express how much it's the importance of stress coping. And I tell people now, for example, that Kellyanne, when we're coming out of the so-called pandemic, the acute phase of the pandemic. And everybody says, oh, COVID done, we ain't got to wear masks, and we good. But we have come out of 2.5 to 3 years of fight or flight.
Yep.
We watch people dying on TV every day. We sat down there to hear from the ministry who dead, who ain't dead. We dealt with all these things, and we were like pressure cookers in our homes and our offices. Yep. We had to do amazing changes, which was not thought to be humanly possible. However, that being said, if we don't now rejuvenate and breathe and exercise and look at how we're eating, then we're going to run our bodies down. And that's why we get the coughs and the colds, and they're not going, because our body had nothing more to give. So this is why it's important to definitely restore, and that's why vacations are important without talking to people from work.
The next question. Okay, so I have no history of cancer in my family. How do I narrow the cancer I should screen for in my 40s?
Nah, you screen for all. And that's important. Screen for what you have to screen for as it pertains to your gender and your age, and listen to your body, because more and more we're seeing changes in that as well. And so it's important that you do that. And it's important that you understand that and put that into your diary. Just like how I go in line with friends, I must go for my screening. So my screening might be on my birthday. Don't put off your screening. Don't worry about your family history alone. You know what I tell you to do, go and do it. Go and get screened, and don't hesitate at all. You have to get screened.
Are all forms of cancer hereditary?
No. Almost all are hereditary, but not all may be hereditary, but it's very rare. Very rare that we see one that it's not hereditary, but not all are hereditary.
Right. Is it true that air oxygen causes cancer to spread more rapidly after surgery or biopsy?
Well, then you're gone dead. Because you have to breathe. Or are you talking about the hyperbaric oxygen? No. No, it does not cause the cancer to spread after a biopsy or anything like that. You have to breathe. In fact, effective respiration will then at a cellular level help to take away the inflammatory markers, help to rejuvenate the cells at a cellular level, and help you. So it does not cause cancer.
Okay. I know you mentioned earlier in your presentation, Doctor, if there's a gene, the BRCA. Yeah. Is that something? So if you're not sure of the family history in terms of cancer and whatnot, is that something that you should randomly, like you're doing your mammogram, you're doing your pap smear, do you put that in there in terms of testing?
First of all, it's expensive. Second of all, opening a can of worms. So
Okay.
that you might not want to open. So it's based on when you find the cancer, the lump,
Right.
right? They may advise genetic testing. If you have strong family history, and let's say my mother was diagnosed with breast cancer, God forbid, then depending on the type of cancer, they may say your children need to do a test. Yeah, because then we see, because what those tell us are those genes turned on or off, and then tells me the risk factor of having the cancer. And then I get the decision to say, will I do prophylactic measures? Will I cut off my breast? Will I take out my uterus? You know, and that is what that is about. Yeah.
Okay.
Mhm.
Okay. All right. Do we have any more questions from our members? Oh, I'm not seeing anything coming in. So, Dr. LeBlanc, I would like to take this opportunity to thank you so very much for presenting for us this afternoon, for sharing your knowledge, for guiding us, explaining a lot more about breast cancer and prostate
Wait,
cancer. And
somebody
the
just
oh
wait.
wait, what? Wait, okay, okay, we're waiting. Yeah, there's definitely a question coming. Okay, it's cancer, and cancer that's hereditary.
I love that.
I mean, I'm seeing the feedback here. They love your presentation. Okay, so cancer is hereditary, and cancer is hereditary. Can it skip a generation?
Yes, it
There you
can.
go.
Yes, it
Yes,
can.
it can.
So
Okay.
again, that's why it's important to understand your history. I have seen, for example, where it skipped a generation and then the next generation only one member gets it and may get it
Right.
twice. So, you know, I think it's important to understand that there is no playbook. There is no 1 + 1 = 2. As you saw with COVID, as you saw with everything, medicine is amazing and your body is amazing, but a lot has changed in our lifestyle. And that is why we want everyone to take in that we now, based on, because remember, long ago, it was wake up, breathe, have a cup of milk, go out to the farm, you know, relax, come home at 2 o'clock, siesta, and life was real slow. And then we went into mechanization. We have to make more money, make more food, and the wheels of the economy are turning. And when we thought with COVID that we were going to rest, and we saw, you remember when you could smell your flowers? You remember when you actually look at your house and say, well, this is what my house look like before 6 o'clock in the morning and after 6 o'clock in the morning?
I was
You
planting flowers.
were planting,
And
right?
you
I
know,
was every morning and exercising. So, I mean, but then we came out of that into what seems a much more accelerated pace, you know? And
Yeah.
so I want everyone to understand that not only that, but COVID has thrown a new dynamic to us as well in terms of our mental health and our stress levels. So it's the onus is on us and corporations such as Cannons Credit Union and other organizations to recognize, and we have to take control as the consumers and as the population, and we have to demand more from the powers that be. You know, can we do staggered work hours? Can we have the remote policy for some organizations? How can we make it so that people can actually do what is prescribed? You understand? But apart from that, make those small changes. I'm not asking you to go home and throw out all your cheesies and your potato chips and your fries, you know. I'm saying moderation. I'm saying look at how you do it. I am not asking you to buy everything name organic, because everything name organic doesn't mean it's organic. I'm asking you to look at your labels, look at what you're doing. Simple things. Why must we have dal in a pack and put water when you could go home and cook your damn dal? So make a decision. And don't get me wrong, you know, if we have a hurricane, I want the dal in the pack because I have nothing, right? I need to add the water. But Lord Father, when we don't have a hurricane, we have electricity, we have the split peas, eat your dal, cook your dal, your tomato
less
chop.
processing.
Less processing, because for that to be on the shelf, they have to process it. Look at the package. It ain't just split peas and water and garlic and jeera. And I know to make dal, just so you know. So it is processed. If you're going to People don't like cow's milk and they say cows this, cows that, but no cow milk supposed to be on a shelf without spoiling. It's supposed to
Yeah,
be in a fridge. And I grew up on a cow farm, so I know that. You understand? So the
yeah,
point is that we have to now look and make our personal decisions. Yeah, but moderation, because just as I say that, I like my chocolate cake. I like a little bit of red wine. I like a little bit of alcohol. But I don't do it every day. You
yeah,
understand? What I could tell you you can't do is you can't smoke and you can't vape because those are killers. And don't
yeah.
let the vaping industry fool you to think that it doesn't have nicotine. It's not what's worse than the nicotine is what they put into it to make you feel like you're doing strawberry shortcake and banana rum cake. You
Because a
understand?
lot of people actually think that, oh yeah, no, I'm vaping. The tobacco isn't going into my lungs because I'm
Yeah,
not using
yeah.
cigarettes.
So
I'm
that will
vaping.
kill you.
And they
And I
think it's better.
It's better. So you could go on CNC3's YouTube channel and you'll see a video we did, a forum we did on vaping, which educates the public, and you could show it to your teenagers and your friends who are vaping. So it's important to make those small yet impactful changes and understand it. And don't get me wrong, every day you ain't gonna wake up and want to exercise and be fit and eat
Yeah,
clean
absolutely not.
burger every once in a while, but you have to do it in moderation, and that is what I want. That is the importance.
Yeah, yeah. Oh gosh, thank you so much, Dr. LeBlanc. I'm seeing all the feedback here commending you on this presentation. Someone saying that they feel like they're knowledge expert in cancer now. Because you've shared such wonderful knowledge with us today, very insightful knowledge. And as you said from the start and you said throughout, it is all about screening early. It is taking the preventative measures, simple little things like adjusting diet, carving out 10 minutes each day or 15 minutes each day to get a little exercise in or something, keeping those stress levels down. But it's a work in progress. And if we see anything that is out of the ordinary or just a general something isn't feeling right, because you can't always put your finger on what's happening. You just know your body feels out of sorts, then don't ignore it.
Don't
Check on
ignore.
it, go to your doctor, don't go drinking all the bush tea that there is, go check it first
And
and
then
make sure. And then you could do, I'm a believer in the bush tea too, so I, I drink my bush tea. But Dr. LeBlanc, thank you so very much. We really, really appreciate you spending your time with us this evening and helping to educate our members. And Mimi, thank you, members, for logging on this afternoon, or tonight, I should say. And this is not the last you're going to see of Dr. LeBlanc. She will be back with us in November because we will be doing another webinar around diabetes. So this is now diabetes awareness. So we hope that you will register for that session and join us. We also do have some weekly webinars that will be coming up in October. As this is Credit Union Month, October is Credit Union Month. So every week we are hosting a webinar. So I think next week we have a retirement planning session. And the week after that, there is one on wills and probate planning, and then a part 2 of the retirement planning session. So we encourage all our members to go to our social media page or go to our website and register for the sessions. These are free educational seminars just for you guys. This session this afternoon, this evening, I keep saying this afternoon, this evening, has been recorded. So we will be placing the recording on our website. So for those who logged on late, I saw someone saying they just joined because they just got home. Do not worry about anything. The session will be recorded, and by tomorrow morning it will be on our website. So you can go back and have a look at it. And even for the members who have attended this evening, you want a refresher, you want to go back and just listen again, you can just go to our website and do that. So once again, thank you to Dr. LeBlanc. Thank you to Victoria Clinics for partnering with us. And thank you to our members for logging on, and wishing everyone a wonderful night. Thanks
Thank you.
again.
Good night and stay healthy,
You're
guys. Stay
welcome,
safe.
Doctor.
Bye.
Bye-bye.